Welcome to Tinnitus Matters, the podcast where we discuss all things tinnitus. My name's Phil Holmes.
And I'm Christine Nixon. And today, Phil, we have a really special guest. It's Caroline Sharrock, who is a specialist audiologist in the transition and additional need patients. And she works at the Lancashire Teaching Hospitals NHS Trust. And she's kindly come to visit us today and talk to us.
Thank you very much for taking the time to come and talk to us today.
Thank you.
So you work obviously in the audiology department, and we know that you work with additional needs and patients that are transitioning into the adult kind of area.
Yeah, that's right.
Why were you interested in that side of the audiology department?
So I have lived experience as my son was diagnosed with a condition called Fragile X syndrome when he was 3.5, and that's the most common inherited form of an intellectual disability. In my experience, obviously, as a mum, I felt that appointments within the healthcare setting generally didn't always go as well as what was expected, as the staff wasn't always prepared for patients with additional needs. So this is the reason why I wanted to improve the experience patients with additional needs had within the audiology department or the audiology service at Lancashire Teaching Hospitals, and mainly to ensure that their support needs and reasonable adjustments were considered to ensure these patients receive the best person-centred care.
Wow, that's fantastic, Caroline. So first-hand experience.
And how long have you been how long have you taken that role on within the service?
So I've been doing this role for about 2 to 3 years now. So and I've built up the service quite considerably with lots of easy read leaflets, so we're able to better communicate with patients with additional needs. I've prepared a communication book which details all our procedures in visual format. And I've also taken into consideration reasonable adjustments. So all patients that come through our doors that have additional needs, we send out a reasonable adjustments questionnaire. So that gives us an idea when we see the patient of what to expect, and also they're able to have a more fluid appointment.
And do you find that having created that literature and all of that extra information helps the parents and the carers?
Oh yeah, definitely, yeah. Because basically, with patients with additional needs, they might not necessarily know what they're actually coming for. So if we provide them with information within a format that they can understand, i.e. a visual format, then it means that they're probably less anxious and they're aware of what they're coming into.
Can you give us an example, Caroline, of, say, a visual, how you would give information visually to a patient or the carer?
Yeah, so basically we've got what's called easy read leaflets, so patient information leaflets, but instead of having lots of words in them, they're more picture orientated. So it shows them exactly what procedures we're going to be carrying out when they attend.
And it alleviates lots of anxiety.
Oh yeah, definitely.
That's really good.
Excellent. So obviously we've invited you into our Tinnitus Matters podcast. So how can tinnitus, or how does or how may tinnitus affect patients with additional needs?
I think it's very difficult for patients with additional needs because they may not have the understanding of what the noises are which they're experiencing. So they could find it quite upsetting. They may not be able to communicate, what they're experiencing. And they might also have difficulty accessing information about tinnitus in a format that they can understand.
Okay. And are there any specific additional needs conditions like autism, ADHD, Down syndrome, etc., that might make it harder for the individuals to describe or manage the tinnitus?
I think any condition where the person has a cognitive impairment will make it harder for individuals to describe or manage their tinnitus symptoms, just due to the lack of awareness, knowledge, understanding of tinnitus, and also communicating that problem to request help and support.
How does tinnitus affect people with additional needs?
Okay, so you may notice some changes in their behaviour. Tinnitus can very often draw people inwards as their attention is constantly being diverted to notice the sounds inside them. So this can affect their concentration and mean that everyday tasks can take longer than usual. They may also be short-tempered, withdrawn or distracted or frustrated.
So some obvious kind of visual signs that you know
Yeah.
that you can pick up on that
Yeah,
others
I
may
think
not.
it could mainly around behaviour. I think somebody with additional needs will display if they've got tinnitus. I think you're probably more
Yes.
likely to notice through behaviour.
Okay.
So with that, if you're a patient or a carer and you have read some uh, information about tinnitus and you suspect that your child or the person you care for has got this tinnitus, they've mentioned things. How can you start to help someone who you suspect's got that tinnitus? What should they do next?
Yes. Yeah.
I think the first thing is, and this is for any patients, particularly with additional needs, show that you understand what they're going through and tell them that. And you also may notice that they've started to avoid things like activities that they previously enjoyed. So if you notice that, make sure you understand that and you let them know that they need to keep on doing the activities that they enjoy. Are they displaying frustration, annoyance or anxiety more than usual? Are they upset more than usual? Could there be any changes that could be made to the lifestyle that may help them manage the tinnitus? It might be if they like sort of quiet time or things like that. It may be that you might introduce something different, maybe introducing some low-level music and things like that might help them.
It's like sound therapy type stuff.
Yeah.
Does that work? Is that the most popular intervention, would you say?
Yeah, and I think what they can also do as well is because a lot of patients with additional needs have care and education plans, and they could also include that in the care plan, maybe allowing some quiet time to make them feel relaxed, because obviously if they're relaxed, that will help with regards to the tinnitus. Obviously stress is a big indicator of, with regards to tinnitus, so definitely allocating quiet time would be a good idea. And also make a sound source available to the person to listen to music and nature sounds.
Sounds that they may like.
Sounds that they may like, that they're comfortable with, and this will distract them away from the tinnitus noises. Another good one is helping them practice breathing exercises to calm them down, and that can help them with anxiety and sleep, because if they're not sleeping because of the tinnitus, that can make the tinnitus a lot worse. But most important thing is making sure the person still keeps doing the things that they enjoy rather than being isolated.
The breathing thing's very interesting because
Yes.
that's during the course of the Tinnitus Matters podcast. That's come up a few times, hasn't it?
How important it is for an individual with tinnitus that they have the breathing exercises in place. It helps them significantly.
So for additional needs, you could actually put that in visual format of how they actually do that.
Oh, right.
So you could put that in picture format of the techniques, because they might not necessarily understand by somebody telling them what to do. Or they could watch a video on it, demonstrate it,
So it's just thinking a little bit more outside the box, isn't it?
Yeah. I think you definitely need to adapt the therapy for the preferred communication method of the patient. They may be that might be using objects of reference, which is actually showing them something physical, using a communication aid, or by showing pictures and symbols of the procedure.
So do you think that's one of the biggest challenges in managing tinnitus for patients? Sorry, my hearing aid's whistling. I don't know if that picked up on the podcast. Sorry, so what are the biggest kind of challenges in managing tinnitus for patients with additional needs, and how can healthcare providers address these challenges?
I think it's ensuring that the patient with additional needs understands the interventions to help them with the tinnitus by making reasonable adjustments for the person during the appointment. These could be speaking clearly and using simple language, having a longer appointment time because they may need extra time to make sure they understand what they need to do. it's really useful to involve the carer, support worker, parent or guardian prior to an
Yeah.
appointment with a patient with additional needs to find out any information which may help the appointment run smoothly. So give you a good idea of how they can understand things and would they prefer things in a visual format. Providing a quiet place to wait prior to the appointment is also useful, because it makes the patient calm down before the appointment. If they're in a noisy waiting room, which very often the waiting rooms are, that can work the patient up a bit more. So when they come into the appointment, you're not going to get the best from that patient with additional needs because they're already worked up because of the noisy waiting room.
So you check all this before the patient comes with
Yeah,
the carer,
yeah.
and then you'll put these strategies in place.
We tend to find out this information from a reasonable adjustments questionnaire, which we
Okay.
send out prior to the appointment. Okay, and that also asks all various different questions about how they communicate and if there's anything that we need to do to help facilitate the appointment.
That's a really tailored plan, isn't it?
Yeah.
That's fantastic.
So, are there any? I just got a question about when they have been referred. So, if a parent or guardian or carer provider suspects that they've got tinnitus, you would then follow the usual steps of going to a GP, and there could potentially be something obstructing there, like wax or what have you. But then they end up at either ENT or audiology. You would go through the normal procedure of hearing tests. Is that kind of just talk me through what would happen on that first appointment for someone with additional needs coming in with suspected tinnitus?
So basically they would be seen for a hearing test. However, it may be that on that particular day they may not be able to do a conventional hearing test. So what would happen then would be that patient would come to me, or they would provide me information of the details of that patient, and then I would send out a reasonable adjustments questionnaire, and to find out a bit more information on how we can facilitate the appointment next time for this patient. Because it may be that we might have to do a special hearing test that's adapted for patients with additional needs. Okay.
And you give those appointment times a little longer?
Yeah, we'll give a longer appointment time. It may be that we might have to have 2 people testing that person, depending on how or what information is put on the reasonable adjustments questionnaire.
And is the end game there to kind of assess hearing loss and a potential frequency area or a sound of tinnitus to give a hearing aid to kind of help mitigate that?
Yeah, so we would try and get where we can. We try and get establish hearing thresholds and see what the hearing levels are like. If they do have an aidable hearing loss, then we would recommend a hearing aid as the first sort of management technique for tinnitus. Obviously, that also depends on whether the person with additional needs will tolerate a hearing aid as well. So sometimes we have to see these patients on a number of occasions. It's not necessarily done, or we don't necessarily get the outcome from the first appointment.
Right.
We might need to see them 2, 3, 4 times before a hearing aid is fitted. Because you've got to build up a relationship with these patients, and they've got to feel comfortable and happy
And have confidence in you and what you're doing.
Yeah,
I suppose.
Exactly. Yeah.
I think the service sounds fantastic.
I think it's incredible.
Yeah,
And
the work you've put into this as well.
I'm learning so much. I know I keep saying that across this podcast series, but I am learning so much about the varied support of the audiology department.
That's available as well, isn't it?
And that is available on the
realise.
NHS is absolutely incredible.
But you've worked hard to build that in place, I imagine.
Yeah.
Has it grown a lot?
It
patients?
Yeah, it has grown a lot. As I say, I've got all the leaflets in place now, the questionnaire, the communication book, which details all our procedures. I've also recently done a video of a walkthrough from the entrance of the audiology department at Preston and Chorley.
Oh, wow.
Because just so the patient can know where they're coming to and they know what rooms they're going to be going to. It just alleviates so much anxiety for these patients. So you're going to get a better outcome from the appointments. It's all very much about pre-planning, and it's really important for those patients because they should have the same appointment as somebody that hasn't got additional needs.
Yeah.
They should expect the same service.
100%.
But the only way we can do that is making sure, as a health service, we take into account people's reasonable adjustments. And make sure we provide information in a format that they can understand.
For the various adjustments needed.
Yeah.
Fantastic.
In terms of current research and research moving forward into tinnitus with patients with additional needs, I know that there's a lot of, there's an area of the autism spectrum that can be highly sensitive to sounds. How does that affect tinnitus, or if somebody's experiencing sound sensitivity? I can't get my words out here.
It is a tongue twister.
It is a tongue twister. How does that sensitivity interact with tinnitus, I guess, the question?
I think, well, individuals on the autistic spectrum often have difficulty processing sensory information. That's very common, including sounds. So even ordinary everyday sounds can be overwhelming and distressing for them. So in a lot of cases it can lead to sensory overload, which cause anxiety, agitation and other behavioural issues. So definitely if somebody on the autistic spectrum has tinnitus, that is going to affect them in a similar way. So you're going to see lots of behavioural issues, agitation. One study has found that 70% of people with autistic spectrum disorder has sound sensitivity, and a significant portion have tinnitus and hyperacusis.
That is such a high percentage.
That's not to be ignored, is it?
No.
That needs actually to be
70%
recognised.
of children and adults with autism are experiencing the hyperacusis, their sound sensitivity and tinnitus. I didn't know it was that high. So
that was really interesting, Caroline, and thank you so much for coming on the podcast today.
Thank you very much.
We've really enjoyed that, and again, we're just learning so much throughout this series, and thank you very much for taking the time out of, we know is a very busy schedule for you guys in the audiology department.
And we hope our listeners have enjoyed that and taken something away from that, 'cause I think we all have, really.
We certainly have.
Yeah.
Thank you very much.
Thanks, Caroline.
Thank you.